So now we're going to look at a little bit of the key features of Capture, and we're going to cover kind of the overview of just the top features. And absolutely, if you're interested in learning more, we can take you through a full conversation of it, and we want you to reach out to us. And as you can tell, I'm very excited about this product, and you know, overall what the solutions can provide for healthcare organizations, and we want to share that with you. So absolutely reach out to us if you have questions after, or you want to see more of the features. So just to point out some of the top features, Capture can be easily accessed several different ways. And so the key here is the patient, the clinician experience. Very busy, as we've said. We want to minimize the time that they're dealing with administrative tasks and technology, and we want them to be able to focus on the patient. So in addition to that, your EHR system is their main go-to technology. So we want to integrate as much as possible as you drive as an organization for us to integrate with that EHR. And so today I'm going to talk about several different ways we can do that and make it more seamless for your clinicians. The first is via URL links within your EHR. So to go to these forms, to go to the Capture product and collect data and collect signatures for informed consent and go through surgical checklists, there can be a link in your EHR that will take you directly there. And again, that makes it very seamless for your clinicians. Capture can also be accessed by a barcode scanning app, which we are also rolling out very soon. And that's actually an iPad native app, and it will, that speeds the process using the patient's wristband. So it reduces the clicks typically to 0 for your clinicians. And that's really, again, the goal. Reduce the number of clicks, increase the time that they can spend, especially in an informed consent process. Again, the time they can spend conversing about the procedure that the patient's actually going to undergo, educating them on the risks and the alternatives. That's going to be of value to the patient. That's going to affect and impact their experience. And the clinician, that's what their main concern is the patient. So we're trying to take the technology out of the equation, but still provide everything they need. Capture can also be accessed through, as seen here, a very sleek interface where all of the patients and all the forms are there, so the clinician can get the forms they need when they need them. So if they're making rounds and they're getting multiple informed consent signatures at once, it's very easy for them to go in and out, and then they need a ad hoc form randomly, they can easily hop into the interface and get that. So multiple ways that we can integrate with other systems, as well as provide a full interface for your organization and your clinicians. Offering the value of Capture. So the next one is mobile device support. So clearly, the clinician experience is going to be better if they don't have to wheel around big carts with workstations on them, and they can easily walk from room to room with an iPad or a Windows Surface device. That's going to improve their experience. It's going to be truly mobile, and it's certainly going to be easier for the patient as well, especially patients that may be in a prone position to view and review documents. It's going to be a better experience for everyone involved. And so our software is compatible across device hardware, and available at the point of care. So whether it's the OR, or it's on the floor, or it's in the ER, the forms are available in a convenient way wherever the clinician is. So the next one is data capture. And so here you see there are quite a few advanced features for data gathering built into that interface. So you have fillable forms to gather all the structured data. You can pre-fill patient information from the system. So it's more integration coming from your EHR to save your clinicians the time of filling all that out or sticking stickers somewhere. It just makes the process so simple and ensures that the information is correct. Drop down. So if we're collecting structured data, we really want that data to be standardized. And we don't want 5 spellings of a certain procedure or a physician. And so we provide drop-downs to prevent that and collect better data. It also improves the clinician experience because it's a lot faster. They don't have to type it in. They don't have to figure out and think, how do I spell that name? I want to make sure I spell it right. No thinking involved. Just select the value and move on. Check boxes, required fields, validation. So clearly an important piece of this is to make sure that the data is collected in its entirety. So all the right data is, otherwise your reporting, your analytics, and your form images aren't going to be correct and they aren't going to provide value for your organization. So we can configure it to make sure that those required fields have values before the form is submitted. Capture is going to ensure that the data that's collected is going to provide value for you. And then also gather signatures. So this clearly is not necessary on every form, but for instance, the informed consent process clearly is important that you're able to gather signatures, multiple signatures, signatures at different times. So there's a lot of different requirements there that Capture is meant and designed to meet in the healthcare environment. Which brings us to the next feature we're very excited about, and that's hyperlinks to content. So it kind of brings the informed consent process alive. When it's on paper, of course you can't click on paper. We have certainly spoken with facilities that then have to have their consent form, and then they have to have another, they have to find the video and pull it up on another device. And we would like to streamline that process. So in those informed consent forms, you can add a link to a video that takes them through the procedure, and it's just that one extra, again, that education conversation may be the only time they get the information they need to make that decision. So they need as much as they can, and people learn in different ways. So this provides a video or a PDF picture option that can help the clinician explain that procedure and takes a little bit of the burden off them in some cases. So, and this provides, of course, impacts the patient experience. They feel more informed, and it didn't add any time or burden on the clinician. Document routing. So I alluded to this a minute ago when I said physician signatures at different times. There are opportunities and certain requirements and forms that may be filled out and started but not finished. And it is helpful to be able to pass that on to other clinicians to be able to report on which forms are incomplete at the moment, to be able to receive notifications that a form is out there waiting on my signature. These are the things that that Capture does really well and extends the capability of beyond just capturing a signature, that now we can route that form, because maybe not everybody was there. Maybe the nurse started and filled in all the data, and then to save the physician's time, and then the physician goes in, everything's filled out, the physician has a conversation and gets everything signed. Practicing at the top of license. That's what we're going for. And so routing makes that much easier, much more manageable, and provides a lot of opportunity for different types of solutions as well. Different types of forms, such as the EMTALA form, other transfer forms, things like that may be a little more difficult to get everybody together to fill out. Technology can assist. Document archival and structured data capture. So we spoke about the informed consent process, and obviously for that we need an image of the form, and so document archival is going to be immediate once that form is submitted. So it's always available for the rest of the care team when they need to see the form. In the OR, it'll be right there in the patient record for them to see. So it speeds along and streamlines that process. But in addition, we've already mentioned structured data capture. So that's going to be crucial for process improvement and improving and adjusting checklists and guidelines, being able to report on the data that's collected and report easily. Capture is going to gather that data for you and can be stored in data warehouses, your other databases, pretty much any database that you want, including the EHR. So in some cases, just a data warehouse is going to suffice and to offer you the ability to get analytics on crucial data that you don't have today. But then in other circumstances, in order to streamline the clinician or your staff's experience and their time, then it may be the most effective way to just go ahead and write back to the EHR. So Capture is prepared to write via HL7 or FHIR back to your EHR. So that opens the door to more solutions and how Capture can provide value to your organization. Okay, we're almost done here. Reporting and analytics, we've really touched on this in a lot of different ways, but obviously data on paper isn't going to help you that much in process improvement and quality improvement measures in clinical standardization. It's not going to do anything for you unless somebody re-enters all of it. Real-time data capture is going to drive the ability for reporting and analytics, and reporting and analytics is going to provide better value and improvement outcomes for your organization. So the Capture certainly has some strong reporting capabilities, but as I mentioned, we can store that data in your data warehouse, and you can use your own analytics tools. So there's a lot of flexibility there on how you want to design, how you want that data stored, and how you want to report on it. Capture is just the tool to gather it.